I'm Dr. Jason Gagnon, a board-certified dermatologist specializing in cosmetic procedures, and today we're going to talk to you about some really fun cosmetic procedures. A lot of patients, when they come to me, are really concerned about, what they'll look like when they're finished with the procedure. They're typically pretty nervous, especially if they're procedure naive. And so I like to start by telling people about my personal aesthetic, which is very natural. I personally don't think that we should be trying to look 20 years younger or like a celebrity, but I do think it's perfectly reasonable to look our very best for our given age and station in life. And I find that that's what most of our patients are looking for. And my job is your guide to help you figure out that journey to where you want to be. A lot of patients, when they first come to me, they're not sure what they want to do. They just know that they want to do something. And a lot of patients will say, what do I need? And the reality is you don't need anything, but there's probably things that we can do to enhance your look that'll make you feel a lot better. And so part of my job is to really ask you a lot of questions and get to know you and the things that are bothering you. You want people to come up to you and say, wow, you look great. Are you using a new skincare line? Have you been on vacation? Do you have a new mattress? They're not quite able to put their finger on why you look good. That's the goal. There are so many cosmetic procedures available. We're constantly bombarded with social media ads and other information about procedures that are going to make us look better or make us look less tired or whatever it may be, and it's really confusing. And part of the work that we need to do together is to parse out what's nonsense and what could actually be helpful. You may come in thinking that you need one specific thing, but it may turn out that it's really something completely different that is actually what you're after. You do not have to worry about ever being overdone because that's not my aesthetic. It's really important to know that my aesthetic is very natural. I want our end product to be you looking fantastic, but I never want anyone to look at you and say, hey, what'd you do? So the goal will always be to make you look your best, but never overdone. It's not just about the cosmetic procedure. It's really about the holistic picture and bringing everything all together. We want to talk about all the things that matter. So the things that everyone should have on board: a really solid skincare regimen. Everybody should be wearing sunscreen every single day without a doubt. We want to talk about rest and diet and stress. These are all things that play a role in how we feel and how we look. And that's part of the conversation because the cosmetic procedures are really just one part. I think that part of what is maybe a little bit unique about me is that my previous training in psychiatry comes through in my dermatology practice because I think that it's really important to think holistically about the whole entire person. Image enhancing procedures can really have a profound impact on a person's self-confidence, and that's nothing small at all. The reality is you don't have to take huge measures to get meaningful improvements in self-confidence, and that's invaluable. I personally think that we need to change the dialogue around these procedures because this is really part of self-care. Just like you exercise and eat right and try to get enough sleep and manage your stress, taking care of how you look makes you feel better, and so that's a part of self-care. There are a million products out there. There's a ton of procedures that are advertised and promoted, and the fact of the matter is they're not all safe and they're not all effective, and the vast majority of them are not being performed by qualified professionals, certainly not board certified dermatologists. And so decoding that can be really confusing, and you really do need an expert to help you walk through that part, because being safe is paramount to anything else that we do. You have to think about safety. You want to know who's performing your procedure, what training they've had, what skills they have. You want to know if the person that's taking care of you is prepared to, properly deal with an adverse event should one occur. We really try to focus on, what's going to be, rejuvenating, what's going to be prophylactic, what's going to be, what's going to help promote skin health. I want people to know that this is a different level of care. This is an elevated experience that is highly personalized and individualized to the actual patient. I don't want anybody to think that there is one size fits all, that everybody should be having this specific procedure. We see this all the time, right? So we get social media stuff all the time. It's like, you gotta try X. And it's like, well, no you don't, because in all likelihood, X is probably not appropriate for you, but we could figure out what is, and that's gonna be a bigger value add to you as the patient than randomly trying a whole bunch of stuff and seeing what sticks, because there's a science and an art to this, and it's real. But we got to engage in a process so that we can actually get there. I mean, I think one of the things I would like people to get from this is, like, I would like people to feel like, oh, here's like a guy like I could sit down and be comfortable with and talk to. Relationships are really important to me, and so it's really important for me to get to know each individual patient, because that's how we're going to do our best work together. Until you have that relationship, everything is transactional. This is not transactional. This is about really truly adding value to each individual wherever they are, in life at any given time. The purpose of the cosmetic consultation is to get to know one another so that we can figure out what the best course of action is, or what the most meaningful treatment approach will be.